Hi, this is Duncan Ferguson. In this very short unit, we're going to overview the therapies, the various medical types of treatment and drug classes for the treatment of hyperadrenocorticism. So I will just go over general basic mechanisms and overview them, and then we will move on in the second and third units to OP prime DDD and trilostane specifically. So there'll be a much more extensive discussion of these more commonly used drugs for hyperadrenocorticism, particularly as they're used in the dog and a little bit in the cat. So here we overview the various drugs that are most commonly used in dog and horse, and a little bit in cat. And so the ones that are the most commonly used are shown here in bold. I'll underline them to emphasize the point. OP prime DDD and trilostane, and there'll be units coming up that will focus on each of these two drugs, and then in the second one about trilostane, we'll use it to at the end of that to compare it to OP prime DDD. But the important thing is that the OP prime DDD is basically adrenolitics. That means that it is destroying. See, that's adrenolitics. It's destroying the two parts of the adrenal cortex histology, the zona fasciculata and reticularis, that are most responsible for making both the glucocorticoids and the sex steroids. This is a drug that, as we'll learn, has to be given continuously, but essentially it is a destructive mechanism to the adrenal cortex. It's a relative of DDT. Trilostane is a competitive inhibitor of an important enzyme for the production of both glucocorticoids and mineralocorticoids, and that enzyme is 3-beta-hydroxysteroid dehydrogenase. Because it's competitive, it means it's reversible, and it also means it's not destroying the actual tissue. It's simply inhibiting an enzyme. This drug has come into favor recently for use in dogs and cats because of the relative safety factor and also because of the comfort with regards to the types of monitoring that one needs to do. It's not a reversible drug, but at the same time it has to be given sometimes multiple times a day. Ketoconazole is a drug that was used for a little while in fairly high doses. This is much higher than the dose you'd use it for as an antifungal drug because of its 17-hydroxylase inhibition at higher dosages. It also affects the cytochrome P450 3A4 enzyme, and the combination of these two effects, particularly at high doses, will lead to the reduction of production of the steroid molecules. However, right now it's kind of fallen out of favor, and ketoconazole is mainly used because of its CYP inhibition activity, and that's to reduce metabolism of other drugs. An example might be cyclosporin. The latter two drugs really get at the issue that in dog and perhaps even more so in the horse, there's some evidence to suggest that hypothalamic dopamine is reduced. And if you remember way back to the early sessions on the physiology of the hypothalamic pituitary interaction, dopamine is an inhibitor of ACTH. So if you take dopamine away, ACTH will go up, and you will end up getting pituitary-dependent hyperadrenocorticism, and that would lead to bilateral adrenal hyperplasia. So these two drugs really are trying to get at, in theory, the location of the problem, the primary problem. Let's start with aldepranyl. Aldepranyl is a monoamine oxidase B inhibitor, and it increases hypothalamic dopamine by blocking its degradation, and that would increase ACTH. This drug took some time, and when it was first came out for use in the dog, it took some time for it to be coming to steady state. The effects were not as dramatic as people were used to at that time, comparing it to OP prime DDD. And in some cases, some animals were less responsive. And I think this could have been due to the fact that the biggest effect of dopamine seems to be in the intermediate lobe. Now, dogs and particularly horses have an intermediate lobe of the anterior pituitary, and this, it's the intermediate lobe of the pituitary, and they have a more prominent intermediate lobe, and this seems to be where the area that is most affected by catecholamines like dopamine. And so there may have been some animals, dogs in this case, that did not have a great response because the intermediate lobe component of their disease was not as great. It's difficult to know. In the horse, the drug that's been used the most recently is actually a direct dopamine agonist. And the reason it seems to work in the horse is because in the horse they have a very prominent intermediate lobe of the pituitary. And by basically providing agonistic activity of dopamine, you end up suppressing ACTH and showing clinical benefit. This drug has been tried in dogs as well for the same reason that aldapurinil was tried, but it had a lot of side effects, particularly GI. So as I said, we will have two units focused on first OP prime DDD and then trilostane in a comparison. But I wanted to introduce you to the fact that these are the most common two drugs that are being used right now in the dog, with trilostane sort of increasing in favor because of an approved drug. Trilostane is an approved drug for the dog, whereas OP prime DDD has been used sort of historically and is not technically an approved drug. It's still available as a drug for cancer in humans, adrenal cancer particularly, but it certainly is indicated for that indication in the dog when that possibility exists of particularly metastatic cancer. And we'll compare the two in our final session. So to summarize the drugs that we have available for managing hyperadrenocorticism, there's three general classes. The first one is an adrenal-lytic drug. It actually is toxic to the adrenal gland and leads to irreversible damage. And then you have an inhibitor of a key adrenal enzyme, trilostane. And then you have agents that are trying to really get at the primary, possibly one of the primary dysregulatory problems in the hypothalamic region, and that is the reduction of dopamine. And so you either are trying to increase dopamine endogenously, which is aldapurinil, an MAO, B, monoamine oxidase B inhibitor, or you're giving a drug like bromocriptine, which is acting as a dopamine agonist.